If you receive a patient in acute flare of ulcerative colitis, then this patient should receive subcutaneous heparin because it is an extremely prothrombotic state to reduce the risk of thromboembolism. If you are sending blood for post-dialysis labs of a patient, then you need to wait for at least 30 minutes because it takes approximately 30 minutes for intracellular and extracellular compartments to equilibrate, and sending blood before this might be misleading in terms of electrolytes. If a patient presents to you in cocaine-induced chest pain, then beta blockers should be avoided in these patients because beta antagonism will lead to unopposed alpha-mediated coronary vasospasm and will further aggravate the condition. We all know that generalized fluid overload can present as bilateral edema, but it is very much amazing to know that it can present as unilateral edema if there is pre-existing venous or lymphatic compromise. Excess fluid will preferentially accumulate on the affected side where drainage is compromised and will give rise to unilateral asymmetrical edema despite systemic fluid overload. As there is balance between inflammatory and anti-inflammatory cytokines in the body, so after the episode of severe shock, anti-inflammatory cytokines such as interleukin 4 and interleukin 10 are released and they trigger immune suppression, making a patient vulnerable to secondary bacterial infections. If you receive a patient in thyroid storm, then aspirin should be avoided in these patients because what aspirin will do, aspirin will displace his T4 from thyroid binding globulin, further aggravating the thyroid storm.